Hi everyone, my name is Jenna McNeill, and today we will be discussing how to define pulmonary hypertension. I'm a pulmonary critical care attending at Massachusetts General Hospital. The key takeaways from our discussion today are to understand the new hemodynamic definitions for pulmonary hypertension, as well as understand the classifications for pulmonary hypertension based upon World Health Organization definition and hemodynamic profiles. To understand how the definition of pulmonary hypertension has changed, we need to first understand how pulmonary artery pressure is defined. So a mean pulmonary artery pressure is equal to the cardiac output times pulmonary vascular resistance plus pulmonary capillary wedge pressure, which is also thought to be a surrogate of left atrial pressure. In 2018, the 6th World Symposium on Pulmonary Hypertension changed the definition of pulmonary hypertension from a mean pulmonary artery pressure greater than 25, or also thought to be potentially overt pulmonary hypertension, to a new definition with a mean pulmonary artery pressure greater than 20 at rest measured by right heart catheterization. One of the major changes for this change in definition was related to a paper by Kovacs that looked at over 1,000 asymptomatic individuals and found that the average mean pulmonary artery pressure for these asymptomatic individuals was 14. And when you think about 2 standard deviations above the mean pressure of 14, you get to a number of 20. The original thought of mean pulmonary artery pressure greater than 25 as the definition of pulmonary hypertension was initially selected arbitrarily. Initially, there are major concerns regarding the inclusion of individuals with a mean pulmonary artery pressure between 21 and 24. However, over the last few years, further studies have come out that demonstrate that those with a borderline pressure between 21 and 24 actually go on to have an increased risk of developing pulmonary hypertension as well as worse outcomes. One of the studies that looked at this was actually a study done by Colgan et al., where they looked at patients with systemic sclerosis who had a borderline mean PA pressure of 21 to 24 and found that when a repeat right heart catheterization was performed at 3 years after the initial, they were much more likely to go on to develop what would be defined as overt pulmonary hypertension or a mean pulmonary artery pressure greater than 25. When you identify an individual that has an elevated mean pulmonary artery pressure, the next step is to think about the underlying causes for this elevated pressure. So when we go back to the original equation that we discussed in the beginning, which is a mean pulmonary artery pressure is equal to an elevation in cardiac output or pulmonary vascular resistance, or potentially an elevation in pulmonary capillary wedge pressure, it helps you think about the causes of pulmonary hypertension. So for example, pre-capillary pulmonary hypertension is defined as having not only an elevated mean pulmonary artery pressure, but an elevation in pulmonary vascular resistance. Potential causes for this are pulmonary arterial hypertension, lung disease or hypoxia, or something called chronic thrombotic pulmonary hypertension. The next category would be post-capillary pulmonary hypertension, which again is defined not only by an elevation in mean pulmonary artery pressure, but an elevation in the pulmonary capillary wedge pressure. The most common cause for this is left heart disease, but it can also be seen in valvular disease or restrictive cardiomyopathy. Finally, we think about states in which there's an elevated cardiac output. So this would be people that have not only elevated mean pulmonary artery pressures, but an elevated cardiac output. As you see, causes of this could be cirrhosis, an arterial venous fistula, or thiamine deficiency. So the equation for how you define an elevated mean pulmonary artery pressure, when you break it down by its components, help you to identify potential etiologies that could cause pulmonary hypertension. Another way to think about how you define pulmonary hypertension is also to think about the World Health Organization classes, which define group 1 as something to do with the vessel itself, or pulmonary arterial hypertension. Classically, this is defined hemodynamically as a mean pulmonary artery pressure greater than 20, a pulmonary wedge pressure less than 15, and pulmonary vascular resistance greater than 3. When you then move on to the second class by WHO, or group 2, that is called causes related to left heart disease. When you think about the hemodynamics that could cause that, it's a mean pulmonary artery pressure greater than 20. But in this situation, the pulmonary capillary wedge pressure is elevated, greater than 15, and the pulmonary vascular resistance, or the PVR, is less than 3. Other definitions of pulmonary hypertension are group 3, which looks similar many times to pre-capillary pulmonary hypertension. And these are diseases that are either related to lung disease or hypoxia. Then when we move on to group 4, we think about chronic thrombotic pulmonary hypertension, which again is looking at something that causes clot or obstruction within the pulmonary vasculature. This similarly can appear on definition as looking similar to pre-capillary pulmonary hypertension. And then finally, group 5 of the WHO criteria is miscellaneous, or a grab bag of other disease processes, for example, something to do with hematologic causes that don't fit classically into either group 1, group 2, group 3, or group 4. Thank you for watching. I hope you found this topic helpful.